Hello, my name is Dana Sherwood, and today I'm going to be showing you how to give an IM injection. I'm going to go ahead and say that I am in the nursing program and I would not actually do this at home. I'm specifically doing this for video purposes, and I'm not actually going to give him the shot. And I also wouldn't do this without nursing supervision. So I'm going to start off by showing you my supplies. I have gloves, alcohol gel for sanitizing my hands, medication that's actually just water. I have alcohol pads. I have a 3mm syringe and a needle for the top of that syringe. And then of course I have a Band-Aid for afterwards. So the first thing I'm going to do is I'm going to perform hand hygiene, which I've already done. The next thing I'm going to do is actually put on my gloves. And then I'm going to open up my syringe and also open up my needle. Now the syringe and the needle connect by like just a twist on motion, and there's a cap on here. So I'm going to take an alcohol pad and my medication, and I'm going to wipe the top of the vial to make sure that it's sterile, that I don't contaminate the medication. I'm going to take the cap off and draw up the same amount of solution that I'm going to put in or take out. I'm going to draw that much in air. So I drew 1 millimeter of air. Then I'm going to insert this into the top of the medication, and I'm going to insert my air, and then I'm going to draw back until I have 1 milliliter of air or of medication. Now, there's air bubbles in here, so all I have to do is flick it until the air bubbles come out. And then I'm going to recap it until I'm ready to give the injection. So the next thing I'm going to do is I'm going to lift up Zach's sleeve here, and I'm going to find his acromion process because I'm going to look for the deltoid muscle to be able to give the injection. So the acromion process is the pointy part that sticks out of your shoulder. So you're going to find that and go 3 finger widths down, and that means you want to give the injection anywhere in this spot. So I'm going to take an alcohol swab, and I'm going to rub the arm in a small circle and go out wider, and you don't want to rub it really gently, but you don't want to rub it really hard either. The purpose of this is to make sure you get all the bacteria off of the skin surface. That way, whenever you actually give the injection, you don't introduce bacteria into their body. So while that alcohol dries, I'm going to take the cap off the needle, but for purposes, I'm just going to keep it on there. That way I don't accidentally stick him. And I'm going to take my forefinger and my thumb, and I'm going to stick it there and hold it tightly. This is where I'll take the needle and I will hold it like a pencil, and whenever I'm ready, I'll tell the patient that there's going to be a stick, and then I'm going to go in a dart-like motion. And once I'm in there, I'm going to put the entire needle in there, and I'm going to aspirate, which means pull back the syringe a little bit, and I do that to see if there's any blood return. And if there's any blood return, then I need to start all over because that means I'm in a vein, and I want to give this medication into a muscle and not a vein. So once I see that there is no blood return, that's when I'm going to slowly push the plunger in until it's all the way down and the medication's been all the way into his body. So that's when I pull the needle out, and I'll put it in a sharps container, which is a special trash can for needles. Then I'm going to take the bandage and put it right over the spot. That way, in case he happens to bleed, he doesn't get any blood on his clothes. And that's how you do an IM injection, and please remember that to not do this at home, and that it takes a lot of special certification and training to be able to do this type of medication.